The second presenter in this session is Bill Hallman, who's professor and chair of the Department of Human Ecology, Rutgers University.
Thanks very much. Slides? So while my slides come up, one of the questions I'm often asked is, what the hell is human ecology? So at Rutgers, it's different than it is at Cornell and other places, where it has the new name for what had been in home economics. At Rutgers, we are 16 faculty members, interdisciplinary social science, focused on the interaction between people and the environment. So my training is in psychology, and what I do is study public perceptions of risk and risk communication. I'm primarily interested in how people think about these particular issues, and then using that information to try to craft messages to help them respond appropriately to risks. So I've been doing this for a fairly long time, almost 30 years, a number of different topics. Right now I'm working on food issues, but I've also worked on things like unexplained symptom syndromes with Dr. Kippen, Gulf War illness, Lyme disease, EMFs, mercury, lead, so a number of other kinds of issues. And I try to think about what could I bring to the table based on that experience that I could say in 18 minutes and 42 seconds. So one of the things that I want to sort of remind everybody is that risk communication is integral to the risk analysis process. We've been sort of talking about, so what do we tell people? Well, that's sort of the end of the risk analysis process. And I would argue that George and Leanne and I have things to offer as well in trying to figure out how to characterize the risk and how to manage the risks. So risk communication isn't just about what to tell people, it's about what are the right questions to ask people as well. We need to be very clear about our particular goals, and I've heard implied several goals. I like to call on the National Academies and their report from 1989. You can download this still from the web. Essentially, they argued that there are three essential goals for RiskCom. One of them is education. One of them is advocacy or persuasion. The other is fostering partnerships for decision making. I actually think we have all three of these goals implicit as outcomes for this particular committee. So with education, what we're trying to do is provide information and context where people get to decide on their own what it is that they should do. That's different than trying to persuade people to change their beliefs, their attitudes, their intentions and behaviors to get them to do something, for God's sake, to stop doing something that's harmful to their health. And that's different from having a conversation, for example, with stakeholders to figure out what's the best course of action that we should take to address these particular issues. And I'll put a plug in here for, at the very beginning, for stakeholder involvement in these particular discussions. So we should be talking with manufacturers, we should be talking with the regulatory community to get their perspectives on how to deal with these particular issues. This is not primarily or necessarily a consumer behavior issue, as we've discussed. As George was saying, simply alarming people can be ethically problematic. We have to tell them not just what the problem is, but what to do about the problem. And clearly interventions can be focused in a number of different areas. We can be changing technology, we can be changing behavior, we can be changing policy or regulations. Each of those requires a somewhat different RiskCom strategy. If we're talking about technical interventions, and we spent a fair amount of time yesterday focusing on filtration, these kinds of things, one of the questions we need to ask is who has the responsibility and the resources to make those changes in technology or in infrastructure, in materials or maintenance. This is a particularly an important issue as Gary and others were saying yesterday for low resource communities. Essentially people who rent don't make permanent improvements to the place that they rent. And they may not have leverage with the landlord or the person who owns the building to put in better filtration or even change the filter when they're supposed to. So one of the things that we need to be thinking about, particularly for low resource folks, is whether there are portable solutions to this. We talked about portable HEPA filters yesterday. What is their affordability? Is this something that we want to recommend? And can we provide some incentives, tax rebates, or whatever to encourage the adoption of this particular technology? George alluded to this as well. The invisibility of particulate matter exposure matters, I would say, a lot. The key issue for me is this problem of invisibility, and George talked about some of the things that we know from the psychometric literature about the different kinds of factors that seem to influence public perceptions of risk and then their behaviors. Just like in chemistry and in other of your fields, there are interaction effects among these particular factors as well. There is an interaction based on the kinds of things that at least I've looked at between undetectable exposures and who's responsible for those particular exposures. So basically, when somebody else is responsible for exposing you to a perceived risk, the perceived risk is greater. One of the things that we heard yesterday is, for example, what your neighbors are doing, what your indoor community is doing, can impact you as well. In fact, one of the reasons I think that we've been so successful in reducing smoking and exposure to secondhand smoke is exactly this, that people who saw themselves as particularly vulnerable saw other people as exposing them to tobacco smoke, to environmental tobacco smoke. And you can harvest that kind of outrage to try to get fairly rapid changes in things like policies and regulations, and that's exactly what we saw with secondhand smoke. In contrast, when you are responsible for individual exposures, it's really easy to ignore those particular exposures. And the prototypical example of this is radon. I was involved in research actually for the EPA in the early 90s, where we tried to get people to spend then $7 on a carbon canister to test their homes for radon, and we could not get them to do it. We tried lots of different ways, including risk comparisons. Neil Weinstein, Peter Salmon, and I, risk laddering. We, gave them, tried to put the risk in context. We gave examples of cigarette smoking. Which people knew about. We gave examples of exposure to chest X-rays, and primarily what we were able to do is to scare the hell out of people about having chest X-rays. So we need to be sort of careful in our particular approaches here. Right? So one of the tasks that we have before us is to try to make the invisible visible, and we've done this, try to do this in other areas. We have smoke detectors, we have carbon monoxide detectors. They're not used often enough, but when they are used, they are protective and they warn people. I did look at the spec detector. It is $200. It's been characterized in this room as low cost. Yesterday, I put myself in the place of somebody who's low resource, and my tax return is $250. Is that where I should put my money? Well, maybe you can get an NIH grant and buy a whole lot of these particular detectors, but that doesn't do me any good as a particular homeowner or particularly as a renter. So how can we make the invisible visible is one of the things that we should focus on. So why is this important? So I'm going to draw from some of the work that I have done on food safety. We know that when the threat is invisible, people will look or make up proxy indicators for the presence of those particular risks. For food safety, I know that it's olfaction, texture, taste, and visual indicators. So people will smell the milk before they drink it, and they'll go, well, it smells okay, it must be okay. The problem, of course, is that particular mental model is wrong because the kinds of bacteria that cause spoilage are not the same kind of bacteria that are necessarily pathogenic. They live in the same neighborhood, but they're not exactly the same, right? So I've done work for the Centers for Disease Control on public perceptions of health and germs, so where the germs are. And one of the things that we find is that Americans believe that a clean-looking home is a germ-free home, okay? Most believe that mold is a good indicator of germs. 3/4 believe that dirt, filth, and bad smells indicate the presence of germs. 43% believe that dust is a good indicator of germs. So what they're doing is using proxies for proxies of things they can see to represent things that they cannot see. And one of the questions that we need to ask is, what are the proxies that people will use or are using for indoor PM? Okay, so the implications of this, particularly in the food safety area, people generally assume that if there are no visual or olfactory issues with the food that they have or the surfaces that they're using in their homes. The absence of these particular indicators suggests a kind of false confidence that there are no particular problems there. I think we have potentially a similar issue with particularly fine PM, where you just can't detect it, you can't smell it, you can't taste it. So we need to think about these particular issues. Size matters, question mark. So based on yesterday's talks, it's very clear that size does matter. It matters to us. The question is, how important is it to communicate size of particulate matter to consumers? And is that the place we really start? I'm going to answer my own question by saying no. I don't think so. One of the things that I do is I work on public perceptions of nanotechnology. This is an effort published by nano.gov to try to put nanomaterials into context. I'll give you 3 minutes to take a look at, no, I'll give you a minute and a half, and I'll give you 30 seconds. You only need 15 seconds to realize that this is a disaster, right? This is not intuitive to anyone. 2.5 versus 10 shouldn't 2.5 be better than 10, right? I mean, there's no intuitive, I want to back winners. I don't want losers like 10. The lack of feedback loops really matters, and it's very clear that there are very few feedback loops without making the invisible visible in this particular area. Again, I'll use foodborne illness examples. People don't recognize the symptoms of foodborne illness. Few people believe that they've actually made themselves ill. Fewer people believe that they've ever made anybody else ill. They believe their own mental model of foodborne illness is you eat something contaminated and then you immediately get sick. And so they don't connect their poor food safety practices with ultimate illness. I suspect that we have a similar issue here, although we really need the research to try to explicate these kinds of things. Here's my mantra for you. Mental models matter, mental models matter, mental models matter, okay? So as George was saying, it is important to understand what people know about an issue, what people feel about an issue. It's important as well to understand what they want to know about an issue, because those are the kinds of communications we want to lead with. We want to answer people's questions. If you answer people's questions, they're more willing to stay around to hear what it is that you have to say that you want to say to them. So those two things are really important. But I would also argue as a psychologist that it's important to understand how people think about an issue, and George was saying that. And by think about an issue, what I mean is how they construct a kind of big picture or a worldview about how these kinds of things work, not simply do they know facts about indoor PM, right? One of the things that we need to realize is that most Americans overestimate how much they actually know about science and technology. If you then, so 20% of Americans rate their understanding of science as poor. Ask them any science question, and pretty much they will get it wrong. So they believe that they know more than they do, and of course the problem is when you don't know what you don't know, you're unlikely to seek answers or to ask questions, right? And so what, in fact, we find in a number of the areas where we ask people about their mental models of how these kinds of things work is that they often exhibit a kind of false fluency. And so we need to be really careful in our social science in how we ask questions, what methods we use. We need to use both qualitative and quantitative methods to try to get at how people think about these things, not just what they know about them. The issue with mental models is that people will try to make sense of the world. They try to create meaning, and they will try to create meaning based on whatever information they have available, and will fill in the gaps with misinformation, bad information, or they'll just make it up so that they have a coherent sense of how to deal with this particular issue. This is a problem. Particularly in the world of the internet and social media, there's lots of bad information, and a quick search on indoor PM issues suggests that there's already a lot of bad information about indoor PM. It's also important to note that people often use analogies and metaphors to organize their particular mental models. So this is work based on some of the stuff that we did for CDC and understanding how people think the immune system works. Individual mental modeling interviews, 37 of them or something like that. We asked, okay, so today we're going to talk about how the immune system works. How does the immune system work? And without prompting them any more than that, and just letting them talk. And often what we heard was the military metaphor. The good guy blood cells, and we often hear, again, the sort of false fluency. There are good guy blood cells or good guy things in your body that go to war on cancer, war on whatever, against the bad guy germs. This is the Osmosis Jones version of how, if you've ever seen that movie, and it makes sense because that's the way we teach fifth graders about how the immune system works, right? And that is great to a certain extent. If you then ask people, as we did, well, then how does vaccination work? Because this is what we were really interested in. People will use the military metaphor. Consistent with the military metaphor, what they'll say is, well, it adds extra troops to your germ fighters. It's like the cavalry riding in, which makes absolute sense, except that it's absolutely wrong. That's not the way vaccination works. So what they'll do is they'll take a metaphor or an analogy that they learned as a fifth grader and will try to extend it to new situations in ways that make sense. So for me as a risk communicator, I know that what I need to do then is to say, well, lots of people think that that's how vaccinations work. So I'm validating what you think and not saying, no, that's stupid. But saying, so lots of people think this, but actually, and consistent with the military metaphor, what vaccines do actually is help your germ fighters recognize the enemy and respond to them more quickly. The immunologists I talk with hate this. But people shake their heads and go, oh, okay, well, that makes sense. We need to find what the metaphors are that we can actually use that will get into people's heads relatively quickly, rather than trying to give them, a lecture on PM 2.5, all right? So mental models of PM, so I was thinking about this yesterday, and there is no data on this. We need data on this. Here are my educated guesses as to how people might respond. Bad air triggers asthma attacks. Nobody in my family has asthma. I don't have a problem. Air pollution is outside. I keep my windows closed so I don't have a problem. Air pollution is caused by cars, factories, and power plants that cause smoke. Sources of air, indoor air pollution have to do with combustion and smoke, therefore. Nobody smokes in my house, therefore I don't have a problem. Combustion is associated with open flames, not electricity. I have an electric stove, I don't have a problem. When I cook, I'm doing this to create pleasant tastes and aromas, not harmful PM. I don't have a problem. Candles produce small flames, so are not a significant source of PM, so I don't have a problem. Water washes things, so it's unlikely that water in my house is a substantial source of PM because it's clean. I buy air fresheners to clean the air, so therefore I don't have a problem. Particulate matter means dust to me. I vacuum twice a week, so I don't have a problem. And who's this Merv guy anyway? And how does he know so much about air filters? And again, we have this issue of a numbering system that isn't necessarily intuitive. Why is 16 better than 1? I want number 1. I want to go with a winner. I don't want 16, right? So we need to think about how we frame these particular issues for people who are real people rather than those of us in the room. It's also important to note that many mental models are actually influenced by advertising claims. One of the things that we need to look at is what information is being passed to consumers through the advertisements for these particular kinds of products. A quick search yields really bad information associated with these particular products. And so one of the things that we may want to do is counter this and say, yeah, lots of people think X, but really Y, all right? Unintended consequences matter. We can't just warn people, we actually have to tell them what they can do. We can't simply tell them what to do, we actually have to help them do it. This isn't simply a knowledge deficit problem. We can't simply give them the facts and then walk away. The advice we give has to be practical, effective, and affordable, and it has to be dependable. One of the things that we find in nutrition advice now is that American consumers have no trust for nutritionists because, we weren't supposed to eat butter, we weren't supposed to eat eggs, and now those are perfectly fine. So why should I trust you, right? We don't want to fall in the same situation. Advice given by credible sources has to be consistent. So we, again, need stakeholder involvement to figure out what it is that we really need to say to people. So we need partner organizations involved with science, with medicine, with engineering. We need the appliance manufacturers. We need the building trades around the table to talk about this. So here's my list of the kinds of things that we will want to be able to answer, and I know I'm out of time. So what are the causes? Who's affected? What are the consequences? Does this explain my existing health issues? Can I do anything about this? Who's responsible for the problem? Who's going to solve this problem? How will I know if the problem is solved, right? And can I trust that it actually has been solved? That does not exclude the idea that we need to do risk communication under uncertainty. Here's my prescription. This is the last thing I'm going to say. We do need to begin talking about this because others are already talking about it. If you aren't out there firstest with the mostest, you seed the ground. So we need to communicate about indoor PM, but we need to acknowledge uncertainty. We need to say, this is what we know now, this is what we don't know, and here's why that matters, right? This is what we're doing to become a lot more certain. And frankly, this is what you can do in the meantime while we continue to work on this particular problem. That is where you can find me. Thank you very much.